Welcome to the deep dive. Today we're really getting into something called bioidentical hormone replacement therapy, or BHRT.
That's right.
There's a lot out there on this, some good, some maybe confusing. So our aim today is to cut through that, find the surprising stuff, and really see why this matters for you.
Exactly. And the core idea of BHRT, it's actually quite simple. We're talking about replacing hormones with molecules that are chemically identical, exactly the same as what your own body makes.
Okay. Identical, not the synthetic versions we sometimes hear about.
Precisely. It's a direct contrast. The basic thought behind it is, look, every hormone in your body does something important. It's there for a reason.
Right.
So when you lose it, well, that causes problems. It's harmful. The logical step. Just simply replace it with what's missing.
That makes a lot of sense when you put it like that. But let's be real, hormones can make people nervous.
So, okay, beyond just replacing what's lost, what are some benefits, maybe surprising ones, that people often miss? What should listeners really take away? Absolutely. Yeah. Let's talk estrogen, specifically estradiol. There's this common fear, right? But the studies, particularly looking at women under 63 or within about 10 years of menopause, they show estradiol is incredibly protective for the heart.
Protective how? Because heart disease is the big one for women.
It is the #1 killer. And we're seeing significant drops in heart attacks, strokes, even overall mortality. There's even evidence suggesting it can help reverse plaque buildup in arteries.
Wow, reverse plaque. That's significant.
It is. And that's not all. It's also vital for your brain health, bone density, even eye health. Starting it early might even help prevent conditions like Alzheimer's. It really flips the script on how we often think about estrogen.
Okay, reversing plaque.
Yeah.
Can you just
Yeah.
quickly explain that? And what about testosterone? Often seen as just a male hormone, right? Especially for women.
Sure. Plaque reversal means those hard deposits inside arteries can actually shrink or at least become less dangerous, which improves blood flow. It's a big deal. And yes, testosterone absolutely crucial for women too. Well, it dramatically boosts sex drive, arousal, overall sexual function. But also, interestingly, it helps reduce feelings of anxiety and depression.
And for men, beyond the usual muscle stuff.
For men, it's great for reducing visceral fat, that really unhealthy, deep belly fat. It improves insulin sensitivity, which is huge for managing diabetes. And, maybe surprisingly, studies show no increased risk of prostate cancer. Some even suggest it might be protective.
Protective. That goes against a lot of old thinking.
It certainly does.
Okay, and progesterone. I hear so much back and forth on that one. What's the absolute key thing we need to know?
The critical thing, really, is the difference between natural progesterone and synthetic progestins, like the commonly known Provera. Natural progesterone. It's actually breast cancer preventive. Yes, which is the complete opposite of the synthetic versions, the progestins, which studies show can increase breast cancer risk. Natural progesterone also helps bones and can really soothe PMS symptoms.
Okay, that distinction is vital. And how does thyroid fit in? People often feel tired despite normal tests.
Right, that's common. So many people struggle with fatigue, weight gain, even when their TSH level looks normal. But TSH, you see, it's just the signal from the brain to the thyroid.
It's not the whole story.
Not at all. Free T3 is the active hormone that's actually doing the work in your cells, driving your metabolism. So relying only on TSH, you can miss the real issue. Optimizing that free T3 level often resolves those persistent symptoms much better than just T4 treatments, which sometimes can even lower your active T3.
Okay, this leads to my next point, something I know worries people. Blood clots and oral estrogen. That seems like a major hurdle. How do we tackle these kinds of misconceptions and also this issue with lab ranges? You mentioned normal TSH.
That's a huge point, the blood clot fear. It mostly comes from older studies using synthetic hormones like Premarin. The research on oral estradiol, the bioidentical form, doesn't show that same risk.
So it's about the type of hormone again?
Exactly. And this ties into the lab ranges. It's so important to get this. Normal on a lab report just means you fall within the average range of a population, which includes healthy and unhealthy people. It doesn't mean optimal for your health and how you feel.
Like the oil gauge in a car example you mentioned, normal isn't empty, but optimal is full for best performance.
Precisely. Your body works the same way. Optimal estradiol might be, say, 75 to 100 pg/ml for feeling great, but the lab's normal range might go down to near zero. And like we said, free T3 tells you much more about thyroid function than TSH alone. And another really crucial point gets missed a lot in interpreting studies. Sometimes research looks at people who naturally have high levels of a certain hormone baseline and also have certain health issues.
Right.
People then wrongly assume giving that hormone must be harmful. But often when we actually intervene and replace a hormone someone is deficient in, the effect is the opposite. It's protective, it's beneficial. Correlation isn't causation, especially here.
That makes sense. It's about replacing what's missing, not just looking at natural high levels. So, if the science points this way and the benefits seem so clear, why don't more mainstream doctors embrace this? Why their resistance?
Yeah, it's frustrating. Often it comes down to, well, outdated guidelines they were trained on, maybe some confirmation bias, and honestly just not distinguishing between the synthetics and the bioidenticals.
They lump them all together.
Often, yes. Or they just haven't kept up with the newer science, or perhaps they reject it because it challenges long-held beliefs.
Yeah.
The focus stays rigidly on hitting those normal lab numbers instead of listening to the patient and optimizing how they actually feel.
So people miss out on feeling better.
Significant improvements, yes. Missed opportunities for better health, more
Yeah.
vitality.
Okay, well, this deep dive has certainly shown there's a lot more to BHRT, especially benefits we might not expect if we look at the current evidence. It really makes you think. What if feeling well isn't just subjective? What if it's actually a really powerful objective sign that your body's getting what it needs, that it's an optimal balance, even if the standard lab numbers look merely okay?
That's a powerful question to consider.
Definitely something to mull over, and we're going to keep exploring this. In future deep dives, we'll get into specific hormones like DHEA, look at more detailed protocols, complex interactions, so much more to unpack.
Absolutely.
So please join us next time as we continue digging into the science for you.